You went to see a urologist, you explained that you had seen these particles in the urine with blood as well. What
Correct.
was the conversation, the initial conversation that you had with the urologist?
He said, if you have some time, we could put a scope up in you and take a look around. I said, absolutely.
So he wanted to get a diagnosis there and then in the office?
He did. He did.
Did he run any urine tests on you before that or no?
No. The first thing he did was put me on a table, and he had some nursing students present, and he asked if it was okay with me if they watched the procedure, of course. And he had a monitor up there, and they put a scope up inside me, and he said, if you want to take a look at the monitor, that white dot, that white dot, that white dot, several of them, I think there were like 7, should not be there. He said, so we want to biopsy these things.
And did he do the biopsies there and then in the office or no?
He did not, no. He scheduled me for surgery for the biopsy.
And although he saw this area of concern on the scope and he talked about biopsies with you, was he pretty certain at that point that you had bladder cancer? Did he discuss that with you?
Yeah, I think at that point, I don't want to get it wrong, but I think at that point, he said they shouldn't be there. I don't think he came right out and said cancer. He said, we want to take a look at this.
So after having the scope in the office, you went straight on to having some biopsies done?
We scheduled a biopsy, correct.
Did you have any scans done before the biopsies, or did you go straight to having biopsies done first of all?
I think we went straight to a biopsy. Don't quote me on that, but I believe that may have been the case. You remember?
I think you're right. I think straight to a biopsy.
Yeah.
So we've heard that Michael had a cystoscopy, a telescope exam performed in the office, and the television screen that's associated with the scope, often the patient and the doctor can see the problem so that the patient sees the abnormal area in the bladder, and then often it's quite obvious, isn't it, that is a bladder tumour, but then we get a biopsy to confirm that diagnosis.
That's right, and the biopsy is very important. I think I understand. We try to provide as much information as is accurate initially, but as physicians we really want to get all of the pieces, and the tissue diagnosis or biopsy that your surgeon then signed you up for afterwards is a critical piece of this.
Yeah.
And provided useful information for your care at that time.
Yeah.
Do you think there's any role in doing any imaging tests before doing an office scope to look inside the bladder? Is it common to go straight to looking inside the bladder first of all?
I think in this case it was a great move because it sort of identified the problem visually first. Usually if we do a scan and there's a bladder abnormality on the scan, they recommend a cystoscopy. So both go hand in hand, and the order is not necessarily important. Imaging is most useful in muscle invasive bladder cancer where we're worried that it may have spread, and then we do more extensive, what we call staging imaging in that setting.
And just to finish off this segment for our audience, we're hearing so much now about different tissue markers, blood markers, urine markers, about how there are these newer tests for diagnosing bladder cancer, even urine tests where patients may be able to pee on a stick, like a pregnancy test to get a diagnosis. Do you think there's any value in those newer markers for screening for bladder cancer in patients who may be at high risk, or these kind of, is there a urine test that we're using now or a blood test that we can use now in the office that may give us an extra heads up that the patient may have bladder cancer rather than going straight into doing a scope?
Right, so there are a lot in development, but I think the short answer to your question is no. None are validated as gold standard diagnostic interventions. In the end, we have to look in the bladder anyway, right? We have to see what's there. We have to get a biopsy to see whether there's muscle invasion. And I don't see a blood or urine test really replacing that. It could be something you use as a first step in an emergency room, for instance, where you can't do an office cystoscopy right away. But in this case, going straight to the cystoscopy is exactly what we would have done at our center also.
And then the tests that we sometimes do in the office, the urine cytology, where we can look at cells in the urine, even those tests, they're not 100% accurate, even for low-grade cancers.
They can have what we call false negatives, meaning they miss it, or false positives where the cells look funny, but really there's no cancer. So there's no replacement yet for the procedures that Michael just described.